Absolutely, Jim and Jackie. 1 year, as you mentioned, since that first case here. And since then, the city has tallied more than 121,000 cases of COVID-19 and 3,187 deaths. And again, that is just in Philadelphia. And health professionals, doctors, nurses, they plan and prepare for pandemics. But this past year was beyond anything they could have imagined.
There was a lot of unknowns. I was concerned.
That was Health Commissioner Dr. Thomas Farley's first thought before addressing the city.
Thank you all for coming.
March 10th, 2020.
We do have the first recognized case of the COVID-19 coronavirus infection.
We knew many people were going to get this infection and some people would die. We really didn't know how bad it was going to be, though.
A public health professional for more than 3 decades, Dr. Farley says the past year has been among the hardest.
Everybody's worked long hours and try to, feel like whatever we do is still not fast enough or not enough. But you know what? This has been tough on everybody.
Businesses shut down, offices emptied out. In the early days, it was testing that was hard to come by. Today, people stand in line several blocks long to get a vaccine. Initially, it was 2 weeks to flatten the curve. Could you imagine that we would be here now?
I figured it would be longer than 2 weeks, but I did not think that we would still a year later be dealing with this. At that time, we were really just trying to slow this down enough to keep the hospital beds still available for people who need it.
It's been a really long year.
Dr. Max Cooper is an ER physician at a Philadelphia hospital. Over the 365 days of long hours and donning more PPE than he ever thought possible, he has seen and felt hope and fear.
There was a moment at the beginning where we were all afraid to go to work, and we went to work anyway.
He documented the past year to show the generations to come what a once-in-a-century pandemic is like. Today, there's a small sense of normalcy coming back. Gathering limits slowly creep up. Fans are back in the stands. Dr. Farley thinks COVID-19 will be around a long time, but now looks to the finish line.
I hope we can come up with a new normal that feels close enough to the old normal that people are okay with that. And so that's. I wish I could say something more positive than that, but that is the way it's going to look in the future.
His department, though, has been criticized for mistakes made with the vaccine rollout, the partnership with Philly Fighting COVID, and restrictions that continue to hit small businesses. He says he wishes he had put out more resources at the start, but doesn't regret the job he's done.
I've had my bad days, as everyone else does, but believe me, I would regret it if I had not been around for the public health problem of the century and not had a chance to try to contribute.
And Dr. Farley said much of the last year was about just trying to buy time from one decision to the next. Even that ER doc you heard from said there is a lot more optimism, especially in the hospitals today. Live in University City, I'm Matt DeLucia, NBC 10 News.
So many people contributed to help, Matt, over this past year. Yeah. Thank you for that perspective.